facial surgery planning secrets surgeons don't tell you. Every successful facelift journey begins long before you step into the operating room. Within the first 5 minutes of your consultation, a skilled surgeon is already evaluating you, your preparation, your expectations, and your readiness for transformation. Hi, I'm Dr. Tim, and after thousands of consultations, I can tell you that what you do before you sit down with your surgeon determines more than half of your eventual success. Today, I'm revealing the insider framework I use to help patients plan their facial surgery. This is the same strategy that turned one patient's consultation from a generic conversation into a personalized roadmap for a life-changing result. In this video, you'll learn the ADDIE framework, a step-by-step system to maximize your consultation results, how to organize photos, documents, and key questions so that your surgeon sees you as a serious, informed candidate, the subtle signals surgeons look for to gauge whether you understand the procedure and its recovery, and how thoughtful preparation can open the door to cutting-edge facelift techniques most patients never even hear about. These strategies will position you as a partner in the process, not just a passive patient. The pre-consultation advantage. Your facelift journey begins weeks before your appointment. Most patients arrive with surface-level questions about cost or downtime, but surgeons quickly spot the difference between casual interest and serious commitment. Patients who arrive with a consultation portfolio, a complete list of medications, detailed timelines of facial changes, family photos that reveal genetic aging patterns, and precise descriptions of their concerns, receive up to 40% more customized treatment recommendations. This preparation shows you understand the facial surgery is a significant undertaking and that you're ready to collaborate on the plan. One of my patients arrived with a 4-year timeline of changes to her jawline and photos of how her parents aged. Her preparation allowed me to recommend a deep plane facelift that addressed her unique aging pattern and delivered a more natural result that she initially thought possible. Point 1. Designing the consultation. The most effective consultations follow the ADDIE framework. A for assessment, that is identifying concerns. D, discussion, exploring options. D, decision, agreeing on the approach. I for implementation, planning logistics. And E, evaluation, setting expectations for results. When discussing concerns, use proper anatomical terminology. I'm concerned about the deepening of my nasolabial folds and the beginning of gel formation along my jawline. Include questions like, given my skin elasticity, would you recommend addressing these mid-face concerns surgically? Or would less invasive options provide sufficient improvement? Visual aids enhance communications. Surgeons often use sketches to explain complex concepts. Engage actively by asking how these visual examples relate specifically to your facial structure and which anatomical features will be modified to achieve your desired outcome. Think of your consultation as a choreographed conversation. Surgeons begin with broad, standard options to test your engagement. Your job is to guide the discussion with well-structured questions, reference photos of realistic goals and specific anatomical concerns like early gel formation rather than vague statements like, I look tired. Use proper terminology, ask how different techniques, SMAS, deep plane, high-SMAS, relate to your unique facial structure and request visual explanations of the exact ligaments and fat pads being repositioned. This level of dialogue transforms the consultation into a true planning session. Point 2, the power of preparation. Preparation signals more than organization. It signals readiness. Surgeons assess not only your physical health, but also your psychological outlook. Patients with clear goals, realistic expectations, and strong support systems consistently report higher satisfaction and smoother recoveries. Arrive with your questions written down, include topics like recovery timelines, complication rates, and how modern facelifts integrate with complementary procedures like neck lifts or fat grafting. Your consultation is more than a meeting. It's the foundation of your entire facial transformation. Using the ADDIE framework and a well-prepared portfolio will help you secure a customized plan and gain access to the most advanced options available. And speaking of advanced options, in my next video, Facelift Innovation Surge in 2025, I'll reveal the breakthrough techniques emerging this year from next-generation deep plane refinements to biological enhancements that promise longer-lasting, more natural results than ever before. If you want to stay ahead of the curve in facial rejuvenation, you won't want to miss it.